A good investment.
It's 9:01. Good morning. Let's into the KUAM News Zoom room where we have hospital spokesperson Mai Habib. Good morning, May.
Good morning, Chris. Good morning, Sabrina and Jason. Good morning, Guam.
Good morning. I'll give you a comment, CG.
All right. You ready?
I hope so. What's coming? Uh-oh.
Yeah, nothing crazy. With low energy Monday, so don't expect anything.
All
too
right,
crazy.
those are my favorite. I'm only going to agree to interviews with you guys on Monday.
All right, so I guess we'll just start with our hospital census on this Monday morning, May.
Sure thing. So we're at 167 total patients, of which 36 are COVID. And of those 36, 8 are in the ICU, 6 of those are on vents.
Have you guys recorded any COVID-related fatalities since Thursday was the last time we received any information?
Yeah, I know that the official sort of communication channel for this is through the JIC, but I will tell you that it was a very difficult weekend at GMH. I can only ever speak for GMH, of course,
right.
But the JIC is sort of cumulative of what has happened and a wider look at the island. But I can tell you that we had several DOAs over the weekend, as well as people who were being treated here at GMH who passed as well. So, and I believe there was another DOA overnight, actually. Again, I'm only speaking for GMH, so I do anticipate. It was a really hard weekend. Yeah, it was a really difficult weekend in terms of COVID deaths. And that is the natural progression, right? So we see community illnesses, we see a rise in cases, and then we see a rise in hospitalizations. And then as people are hospitalized and as they are critical, especially, the treatment can only go so far. And if they have tons of comorbidities or so many issues that, even if they had a quote unquote normal flu or a normal quote unquote case of pneumonia, it would have been really difficult for them to survive as well. And then sort of the tail end of that circle, this vicious cycle of COVID, is that we do see deaths. And that's why I think we're seeing more deaths being reported.
Mm-hmm. You said several. Can you put a number to that?
I know that by Saturday evening, we had 5. I'd have to go through and check. And like I said, I know that there was another one overnight. So I know that between Friday and today, just at GMH, between DOAs and in-house, we're looking at about 6.
6 COVID-related fatalities over the weekend? Oh, God.
Were any of them children?
No, I believe all of them were not children, not pediatric patients. And in fact, we don't have any pediatric COVIDs here in the hospital, admitted in the hospital as well.
Mm-hmm.
It's not to say that there aren't children testing positive. We are seeing parents bringing in their children for various symptoms and then they test positive, but they're able to isolate and continue, normal care at home. But we have no pediatric COVID patients.
Mm-hmm. What about over the age of 15?
I mean, I think pediatrics is 18 and under.
18?
So I think anybody would have been older than that. I don't recall seeing anybody in the 20s. I think everybody was 50 and over. I'd have to go back and look at the ages. But I think I believe, I don't want to misspeak, but I believe everybody was over the age of 50 at least.
Mm-hmm. Then I guess with the morgue, is the cold storage unit, is it called a reefer? Has it been brought over to GMH?
It has not been brought over yet. I know that the work is underway and the conversations continue of the planning with the gun to bring over the materials and have it ready as soon as possible. There's no final date of when that's coming, but it's still something that is tracking on our end.
Mm-hmm. What about the team of nurses that are that has been requested? Is there any update?
Yeah, so it's we've gotten confirmation that they are in fact trying to send us people. I think it's looking like it will be 15 nurses. I think I've mentioned this before, but there's such a stretch on the active duty community that it will end up being reserve nurses who are actually, I think, already sort of deployed in various areas to support the COVID efforts, is just sort of their next, where are you going next? But they are reservists. We're expecting them hopefully by the end of this week, early next week. We don't have final confirmation. When you're dealing with such a big beast, and DOD themselves and FEMA themselves, they have so many moving pieces to try to figure out themselves, but we are really hoping for the help as soon as possible. Hopefully, like I said, by the end of this week or early next week, we should have boots on the ground, so to speak, and get them into the hospital.
RegenCov shipments, did you guys get anything else?
You know what, actually, we did get a shipment over the weekend. Our team was there to receive it right at the airport. So shout out to our team for being there. I know that it was a shipment of 480 vials over the weekend. And then we were able to grab that. But the GUNG and FEMA are now dealing with the monoclonal clinic itself. So the vial division will sort of be based on that, where the need is. But I know that we got another shipment of 480 vials over the weekend.
So GMH is getting their own shipment, and then you guys give it to public health. I guess there was some kind of confusion, like is public health getting their own shipment and then GMH getting their own shipment, or it's just one big shipment and you guys divvy it out?
It is one shipment.
Okay.
So far, nothing has changed in our ordering structure, and GMH, basically the way it works is HHS will let us know what we can order. Like, what is our allocation that we can put the order in, and then we put the order in, and then once it comes, it's divvied up among the various clinics that need it. So between us, between GRMC, and then now, of course, the GUNG is running in Manila, the monoclonal treatment center there.
And are people actually taking advantage of it over, at least at GMH?
From everything I've seen, people have been taking advantage of it. I have seen very few people that have, in the chats that I'm privy to and in the conversations that I'm privy to anyways, that are saying no. But I think, we're capable of doing about 7 to 10 a day. I don't know that we're maxed out at that, but whenever somebody is eligible for it, I think a lot of people are trying to get it.
Okay. Anything else going on over at GMH that the public should be aware of? We're working hard. I can tell you that the staff is really exhausted. The frontline staff is really exhausted. It's been a long stretch. This really started at the beginning of August. We started to see an upswing. So it's been nearly 2 months. The message really is still get vaccinated from us, because again, even though there are breakthrough cases, the chances of you surviving, your mortality rate and the severity rate and the acuity rate are greatly increased by having this vaccine. So we really still encourage a lot of people, as many people as possible, to get vaccinated. This morning, actually, if I can say thank you to PenFed, to the staff at PenFed, they made a delivery for our frontliners. They stopped by with breakfast and coffee for our frontliners, which, is a very little thing, but it goes such a long way. When you're putting in time and overtime and not seeing your family and just sort of in the grind of things, you kind of lose perspective, and having that thank you from the community and that backing. And we get a lot of donations. This just happened to be the one from this morning. So I really did want to give them a shout out today for that. And I guess just, has there been any other new infections over there at GMH?
Employee-wise?
Yes.
We have had, our most recent was confirmed on Saturday. So our most recent one was confirmed on this weekend, yeah. Again, a lot of it is community spread. A lot of it is household infection and being out. And, the reality of being in multi-generational homes or having just COVID in the community. If people are catching it, then of course our people are exposed as well. So our most recent employee was just this weekend. And I've said this before, and I'll emphasize it again. I can't say enough about our infection control teams here. We also implement in-house the Sarah Alert program. So all our employees are required to report daily their symptoms so that we can track and sort of try to get ahead of things. If somebody's coming in and says, hey, I have a bit of a scratchy throat, or this weird cough developed overnight, we can catch it right away and quarantine them and then test them at the appropriate times, because sometimes if you test early, somebody will show negative, but in fact, the virus is still incubating. But in terms of employees, right away, infection control gets involved, contact tracing, people are put in quarantine and tested, which comes down to another reason of staff exhaustion, because between quarantining and isolation, that takes away from the staff that's able to be here in rotation.
I know you mentioned that a lot of it is from the community, but has any of the infections occurred at GMH?
A handful of the cases have, but it's not because of dealing with COVID. Actually, the irony is that none of them have been dealing with COVID, because when you're going in to deal with COVID, you're donned in extreme PPE. You almost look like you're going to like a biohazardous wasteland, with really fully covered. Most of what has happened at GMH, which again is a very limited amount of cases, has been people that are going in to treat for, say somebody comes in for a broken leg, right? Hypothetically speaking, and they're coming in and they, our staff goes in with a mask, which is the proper, like a surgical mask, obviously, or a KN95, and goes and deals with that person. And then that person ends up being positive. So they didn't actually come in for COVID or COVID-like symptoms at all. They were in something completely different, like something like a broken leg, broken arm, sprained, whatever. They come in, and then when they're admitted, obviously they're tested, and we've been dealing with them. And then if they turn out to be positive, those have been really a few cases.
All right. Well, thank you so much, May, for coming on and always being accessible.
Absolutely. Thank you so much. Thanks for spreading the good message.
Oh, anything on your vaccination rate, as we're now up against that deadline? What percentage are you guys at, and how many more?
We only have actually a handful left. So our total count that we're accountable for in terms of vaccinating is 1,300 and something employees. And we have about 50 something left that are unvaccinated. And they've been going through the testing and will continue to go through the weekly testing, which is part of the mandate. So we have very few that are left that are not vaccinated.
Okay. Thanks, May.
Thanks, May. If you could hold, though, because I just needed to ask you something offline. But
Okay.
Thanks.
All right. Okay, kindly hold, please.
Yeah, will do.
We're going to take a break. We'll be back with more of The Link next. Good morning.
Learn about people.
Breast cancer is the second leading cause of cancer death in women. The chances that a woman will die of breast cancer is about 1 in 38. Although there is no sure way to prevent breast cancer, there are certain things that you can do, such as eat healthier and exercise. For more information about breast cancer, go to the American Cancer Society's website at cancer.org. Also, on October 22nd, we invite you to think pink by wearing the color pink on that day in solidarity of our breast cancer survivors and warriors.
This pink message is brought to you in partnership with Ordot Dental Clinic. Joining the